Today we will discuss about the Norma frontalis. Inside the Norma frontalis, we will discuss into the following head. This is the forehead. This is the pair of the orbit. This is the prominent part of the zygomatic bone. It is called the Malar eminence. There is a opening of the nasal cavity. It is the nasal aperture, and the tooth bearing area of the maxilla, and also inside there is a lower portions, there is a tooth bearing area of the mandible or jaw. So this is a mandible and it is also tooth bearing area, but right now we will discuss about the bone inside the skull. Inside the forehead we will discuss the nasion. The nasion, it is the, these are the two nasal bones. There is a very small bone, quadrangular in shape, and this nasal bone which is articulated with the frontal bone. So root of the upper border of the nasal bones which is united with the frontal bone, it is the nasofrontal sutures. This junction, it is called the nasion. Other thing which is the on each side of the lower part of the forehead, there is a above to the margin of the orbit, there is a elevated area of the frontal bone. It is called the superciliary arch. So superciliary arch, and middle of this superciliary arch above to the nasion, there is a point we will consider as a glabella. The above to this, there is a above to the superciliary arch, there is a prominent process of the frontal bone. It is called the frontal eminence, which is more prominent inside the female as compared to the male. Now we will discuss about the orbit. This orbit it contains the eyeball, as well as there is a extraocular muscles and vessels and nerves which is present inside the orbital cavity. It has a basically four margin. This is called the upper margin, this is called the medial margin, this is called the inferior margin, or it is also called the infraorbital margin, and this is called the lateral margin. So now we will discuss one by one. Supraorbital margin, which is mainly formed by the frontal bone, and there is a which is mainly formed by the frontal bone, and the supraorbital notch. Here you can see this is a supraorbital notch, or it is here you can see that it is converted into the foramen, but mostly it is notch, and it passes the supraorbital vessels and nerves. So it is a supraorbital foramen or notch which is situated junction of the lateral 2/3 and medial 1/3 of the junction of the supraorbital margin. Other thing, there is a medial to supraorbital notch, there is a supratrochlear vessels and nerve which is passes on the medial margin. Lateral supraorbital margin and into the zygomatic process of the frontal bone, and it is articulated with the frontal process of the zygomatic arch. So this is the front, and it makes the frontozygomatic sutures. This is the frontozygomatic sutures. Lateral margin, which is formed by the two things. Here you can see this is a frontal process of zygomatic bone and zygomatic process of frontal bone. Both are united. It makes the lateral margin of the orbit. Infraorbital margin, which is formed by the two things, which is formed by the zygomatic bone, and it is also formed by the maxilla. So infraorbital margin, which is formed by the two bones. Just below to the infraorbital margin, there is a 1 centimeter below, there is a infraorbital foramen, and this infraorbital foramen which transmit the infraorbital vessels and nerves. So basically you have to remember infraorbital margin which is formed by the maxilla, and it is formed by the zygomatic bone. And here you can see this is the maxillary bones which is united with the zygomatic bone, and it forms a zygomatrico maxillary sutures. This is a zygomatic maxillary sutures. The medial margin of the orbit, which is formed by the three things you have to remember. This is the maxillary uh, bone, and it process which is goes towards the frontal bone. So frontal process of maxillary bone, as well as it is formed by the lacrimal bone and part of the nasal bones. So three bones which is forms the medial margin of the orbit, and it is not well defined, but you have to remember most anteriorly it is formed by the nasal bones, then frontal process of maxilla, and the most posteriorly the medial margin which is formed by the lacrimal bone. By you can see inside the lacrimal bone there is a lacrimal groove. Now we will discuss about the malar prominence. Malar prominence of the cheek, which is mainly formed by the zygomatic bone, and it is situated infralateral to the orbits, and it is rest on the maxillary bones. It has a three surface and two process. We will discuss the three surface. It has a this surface which is considered as a lateral surface, and there is a small foramen. It is called the zygomaticofacial foramen, which transmit the same name of the nerves from this. The other surface of this malar eminence, which is the contains the orbital surface of the zygomatic bone. This is the orbital surface, and this orbital surface forms the lateral and inferior border, or lateral or floor of the orbit. And the last one of the zygomatic bone, it is posteriorly this surface, it is called the temporal surface, and which is lies the temporalis muscles, and also it is communicated with the infratemporal fossa. It has a two process, one which is process goes upwards, which is called the frontal process, and it is united with the frontal process, zygomatic process of the frontal bone. Another process which is goes on the back side, it is a temporal process of zygomatic bone and zygomatic process of temporal bone. Both are united, and it makes the zygomatico-temporal sutures, and it completes it completes the zygomatic arch. The most upper part of this zygomatic arch goes anteriorly, continues with the zygomatic bone and united with the frontal bone, and it is a italic shape of the zygomatic arch, and it continues as a superior temporal line. After that it becomes continuous as a superior temporal line. Now we will discuss about the nasal aperture. This is the nasal aperture, and this nasal aperture, which is the pyriform in shape, it is bounded by the nasal bone above. Here you can see there is a above, there is a nasal bone, and below, which is below and laterally, which is bounded by the maxillary bones. The median bony projection of the maxillary bone into the lower aspect of the nasal aperture, it is called the antenasal spine, which is projected and it forms the part of the nasal septum. So the nasal septum anteriorly, which is formed by the cartilaginous part, and it divide the nasal septum into the nasal cavity into the two part, the posteriorly and superiorly, which is which is formed by the perpendicular plate of the ethmoid bone, and posteriorly and inferiorly, which is formed by the vomer bone. So the nasal cavity, which is basically divide the three things: anteriorly nasal septum, posteriorly and superiorly perpendicular plate of ethmoid, and posteriorly and below by the vomer bones. And on the lateral wall of the nasal cavity there is a three concha, which is a superior concha, middle concha, both are the part of the ethmoid bone, and inferior concha, which is separate bone, which is the largest bones. Just under beneath there is a concha, there is a meatus, superior concha under beneath it is a superior concha, superior meatus, middle meatus, and inferior meatus. Now we will discuss about the upper jaw, and upper jaw, which is mainly formed by the both side of the maxillary bones, which makes the upper jaw, and maxilla, which is the pyramidal in shape of the body. This is the pyramidal shape of the body, and it has a four process. One process which is towards the zygomatic bone, it is called the zygomatic process. process towards the frontal bone, it is frontal process. Towards the lower aspect, upper jaw, which is the palatine process of the maxilla, and this is the tooth bearing area. It is both side of the maxilla. It makes the dental arch, and it alveolar teeth which is process inside. It is called the alveolar process. So there are four processes, and the body of the maxilla, which internally it contains the, it is a cavity, and it contains the maxillary air sinus, and it is a basically four surface, which is it present a four surface, and it is towards the nasal bone, towards the nasal cavity, it is called the nasal surface. It has a upper part, it is called the orbital surface. It has a lower, this is the facing towards the face, it is called the anterior surface, and posteriorly this surface, it is called the posterior surface of the maxilla. So maxilla have a four surface. This is towards the nasal cavity, it is a nasal surface, orbital surface, anterior surface, and posterior surface. Now we will discuss the one by one surface. This nasal surface, which there is a, it gives the lateral wall of the nasal cavity, and there is a three concha also which is articulated, and there is a opening of the maxillary air sinus from the nasal surface. Another thing, this is the anterior surface. Anterior surface, over the anterior surface there is a one opening, it is called the infraorbital prominence, and it passes the infraorbital nerve and vessels. Also here you can see this is the canine eminence, and this projected part here just below to the infraorbital opening, and previous skull we are not able to see the canine eminence, but here you can see these are the incisive fossa, and after that there is a elevated area above to the canine root. This is called the canine eminence, and just medial to the canine eminence there is a canine fossa, and lateral to this fossa it is considered as a medial to it, it is called the incisive fossa, and lateral to it, it is called the canine fossa. And the posterior surface of the maxilla, which forms the infratemporal fossa as well as pterygopalatine fissure, and it continues as a fossa. The superior surface, superior part of the maxillary bone, which makes the floor of the orbit. So these are the four surface. Orbital surface, it is the superior surface of the maxilla. Anterior surface, this is the nasal surface which makes the lateral wall of the nose, and posterior surface which makes the infraorbital fossa as well as pterygomaxillary fissures. It continues as a pterygopalatine fossa. Previously I already discussed the maxillary bone have a two process, which is the upward process which is towards the frontal bone. This is the frontal process of maxilla, which is articulated with the frontal bone, and it makes the frontomaxillary sutures. Anteriorly, this frontal process of maxilla, which is articulated with the nasal bones, and it makes the nasomaxillary sutures. Posteriorly, this frontal process of maxilla, which is articulated with the lacrimal bone, and it makes the maxillolacrimally sutures. And laterally, this maxillary bones, which is articulated with the zygomatic bone, and it is forms the zygomatrico-maxillary sutures. So this is about to the maxilla, and here you can see this both side of the maxillary bones on the bone on the inferior aspect, which makes the alveolar process, and it for the socket for the tooth, and also inferiorly this maxillary bone which makes the on each side, this is the intermaxillary sutures, and it makes the hard palate, and posteriorly it is united with the palatine bone, and it makes the palatomaxillary sutures, and both meeting point, it is called the cruciate sutures, but we will discuss into the Norma basalis, and also there is the Norma frontalis, which is also formed by the part of the lower jaw, and lower jaw, which is mainly formed by the mandible, and we will discuss the mandible in detail during the mandible bone. This is the body of the mandible. It is a horseshoe shape, and this is a rami of the mandible. It has a two process. This is the coronoid process, and this is the condyle process. Maxilla, mandibular have a two border, upper border. It is called the alveolar border, or this is the inferior border. It has a two surface, outer surface, and this is the inside. There is the inner surface. But we will discuss the mandible into the next lecture. And there is a one foramen inside the mandible, which is the mental foramen. Inside the norma frontalis, another two foramen. This is the intraorbital foramen, which passes the intraorbital nerve and vessels. This is the supraorbital notch or supraorbital foramen, which passes the supraorbital vessels and nerves. So I hope you enjoy the lecture of the norma frontalis. Thank you very much.